A lot of patients, I think, they initially will bring it up with their primary care provider, but it takes a lot to get to that point to actually talk to their primary care about it. So sacral neuromodulation refers to using an electrode to stimulate one of the nerves in the sacral region, and that nerve communicates with the nerves that control the bladder and bowel. And that stimulation then normalizes the nerve signaling to those parts of the body. I have personal friends who've had sacral neuromodulation done and had great results, and I think of them as somebody like myself, someone who has a busy schedule and goes to work and takes care of kids and wants to have optimal quality of life. So one of the advantages of the Axonics system is the small size of the device. Another nice feature is the battery life, 15 years or so. From a patient standpoint, the idea of not having to come in for regular battery changes is appealing. I find that patients are able to live their lives like they were previously living them before they had this condition. Most of the patients I've implanted have been very happy with the therapy. Not everybody has 100% results, but rather significant improvement in quality of life, and that's really what we're looking for.